Shasu. Na Adiba, Mayamaye, so Fabi, a woman, and Brim. That's the story of Janet. The daughter is also here, but for obvious reasons, I cannot bring her up. I'll try to do a quick translation, except the such a part. But of course, she's hoping that MAHAMA Cares is here to stay. She highlights the situation she's faced with together with her daughter as a result of the sickness or the diabetes that they're having to live with. And they are hoping that there will be subsidies on medications for them and those living with that disease. Rather a touching story, but it's time to uplift ourselves because we know that there's a new era in chronic disease care, and that is in MAHAMA Cares. At this point, it's the MAHAMA Cares initiative, which is the Ghana Medical Trust Fund. I'll tell you something. Yesterday, a Jumara was launched. Today, MAHAMA Cares is being launched. Tomorrow, the National Apprenticeship Program will be launched. That's more. Relax. On Thursday, we'll have the Black Star Experience launched. At this time, you can do it. It is now my distinct honor to respectfully invite the President of the Republic of Ghana, John Dramani Mahama. Please, shall we rise? Give him the thunderous applause as he comes to stage to speak to Ghana.
Thank you very much. With what she's going through, because she's just one of many of our citizens and countrymen and women who are going through what she just talked about. And the perception was that if you mention cardiovascular diseases, diabetes were diseases of the rich, but increasingly persons who are much poorer and can least afford to be able to manage those diseases. And that's why the Ghana Medical Trust Fund has come at the right time. I have a personal connection to non-communicable diseases, and that is because my father died in 2001, and he died of prostate cancer. My mother died in 2016, high blood pressure and diabetes. My stepmother died of breast cancer. I lost a friend and somebody who worked for me last year. We celebrated 1 year since she passed. I'm sure most of you know Mawela Dumo. She died of breast cancer. And currently, I have a staff in my office whose son is in his 30s and is on dialysis, is suffering kidney failure. And so these are not things that are far away from us. These are things that are close to us. We must not see them as statistics. We must see them as real lives that we need to touch and help. But there's the even sadder story of Trump supporters when I started this whole political journey. He was an assemblyman and he was an executive of our party in Bole, where very close to me, went everywhere with me anytime I went back to the constituency. He was in charge of above Kumasi. He had to travel to Kumasi to do dialysis. And so he used to travel from Bole Bamboy like once every week to do dialysis, go back, and the cost was unbearable. I tried to help as much as I could. Eventually, treatment, and so he couldn't be going and coming. So he had to move his whole family to stay in Kumasi, rent accommodation in Kumasi, so that he could be close to Komfanoche, where he was undertaking the dialysis. I also tried to support the costs. He died leaving poverty behind because he sold all his assets to be able to look after himself. And so we had to take care to support some of the children to be able to finish school and all that. These are real stories, and that is why what we're doing today is important, because they will touch a lot of lives and help a lot of our fellow citizens. But let me say that this program must be linked and will be linked to our primary health care project, which we are yet to launch, because under the primary health care, we envisage that there will be volunteers and designated community pharmacies where our citizens, wherever they live, or the chief compounds, will be required to go and take their blood pressure, check their sugar, because like was said by the UNICEF director, these disease trouble outcomes have community volunteers who go from house to house occasionally, maybe every 3 months, every 6 months, and just take people's blood pressure, check their sugar level, and all that. We'll have a program where women, are able to detect lumps earlier. I think there should be a linkage between MAHAMA Care and the care program when we launch it. But more especially, a lot. And so we must also, as part of the Ghana Medical Trust Fund program, launch a very strong awareness campaign so that people will know these non-communicable diseases are. Understand that, but a far greater number genetic is in their lifestyle. I'm sure that we should be able to bring down, the level of disease burden that we currently are seeing. I want to thank our brother from Calbank for the very good testament he made about the need for support by corporate Ghana in this particular exercise. And I want to encourage corporate Ghana, businesses, the mines, the banks, and all the other companies that this Ghana Medical Trust Fund program is coming to help our clients who save their money. I'm deeply honored to join you this morning for the launch of the Ghana Medical Trust Fund, MAHAMA Cares, as it's called, initiative introduced by my government to decisively commits the global community to reduce premature mortality from NCDs by 1/3 by 2030 through prevention, treatment, and promotion of across the global and undermine economic development. Vulnerable populations, that is those with lower education, are currently most at risk. Addressing the NCD menace is therefore not merely a health imperative, it is essential for advancing economic growth, promoting social justice, and securing environmental sustainability. In Ghana, the picture is equally alarming. Available data indicates that NCDs amount for over 40% of all age category mortalities, and they consistently rank among. Even more disturbing is the steep rise in hospitalized cancer cases, which jumped from 3,487 patients in 2012 to 16,105 in 2016. Alarmingly, adults aged from 18 to 45, the prime of our nation's workforce, account for more than half of these cases, diets and sedentary behavior, and also increase in mental tests. The consequence, gentlemen, is not. Estimates from our teaching hospitals reveal that the average annual cost of non-communicable disease treatment per patient averagely stands at approximately 53,000, equivalent to about 3,300 US dollars. Managing chronic conditions imposes crushing financial burdens on families, often pushing them below the poverty line and deepening their vulnerability. It is estimated that individuals diagnosed with chronic diseases face a 75% likelihood of falling into poverty within 5 years, regardless of their original economic standing. And so it even ruins rich people. I mean, you spend all your money trying to find a cure. Those battling kidney and cardiovascular diseases are reported to spend between 70% and 95% of their non-food expenditure on health care alone. Older adults living with chronic conditions spend 5 times more on health care than their healthier counterparts. Despite the important strides made through the National Health Insurance Scheme, it remains inadequate in fully covering NCD. In 2018, around 48% of all NHIS claims were related to non-communicable diseases. Yet essential services remain outside the NHIS coverage, leaving families dangerously exposed to out-of-pocket payments. It is against this background that shortly after my election as President, I directed the Honorable Minister for Health to initiate the establishment of the Ghana Medical Trust People's Manifesto of the National Democratic Congress. Following extensive consultations with inputs from over 3,300 stakeholders, the National Task Force I formed, ably chaired by Reverend Emeritus Professor Seth Aite, submitted its final. I'm pleased to inform you that the accompanying draft bill, as the Minister said, is ready and will be presented to Parliament when it resumes at the end of next month. Ladies and gentlemen, today we're launching more than just an initiative. We're launching hope. Hope for thousands of Ghanaians living with chronic diseases. Hope for families battling the overwhelming cost of care. Hope for a future where the quality of life is not determined by one's ability to pay for essential treatment necessary. The Ghana Medical Trust Fund will support specialist-level treatment for a range of chronic diseases, including cancers, diabetes, cardiovascular diseases, chronic kidney failure, stroke, and other complications. It will also progressively expand to cover convalescent care, palliative services, and home-based support. Support from the fund will be based on formal applications, carefully vetted, and will focus on costs not currently covered under the NHIS. The fund will operate as an independent statutory trust, governed by a board of trustees and supported by dedicated administrators to ensure transparency, efficiency, and a patient-centered service ethic. Initial projections suggest the fund will require approximately 3 billion Ghana cedis annually over the first the NHI, institutions and individuals, grants, and will also be able to invest in order to raise income, investment income. Strategic procurement measures such as access pricing and framework contracting will ensure that essential medicines and diagnosis are acquired sustainably. And so I spoke to the minister and asked if we couldn't encourage our local pharmaceutical industries to increase the availability of generic drugs, which are much cheaper than the imported, between the imported drugs and the difference in cost. And so if we can encourage our pharmaceutical industry to produce generic versions of those drugs, it will bring the cost much lower. I wish to commend the exceptional leadership of the National Technical Task Force, chaired by Reverend Emeritus Professor IT, their expertise and passion to bring this initiative to life. Your stated manifesto process changes person. Then
please, you can take your seat. You can take your seat. But we've got $1,000. We have 6 months salary. I think it's a good time to do a mini fund for Your Excellency. Do you have any takers, or you want to give him? Do you have any takers, or you want to give him on the quiet? I'm looking at Asina Laki, Seydou Agungu. Well, so his boss is giving 6 months of his salary. He can't go beyond his boss. So he will do 3 months. Thankfully, there are 3 ministers.
We also cannot go above the minister for health. Colleagues, the 3 of us here, we are doing MRTs. Thank you very much.
Well, we have the Vice President's Chief of Staff here. We have the Deputy Chief of Staff outside. We have the Secretary to the President. And I see Corporate Ghana. I see CalBank. I see MTN. I see Telecel. I see NHI. I see Ghana Health Service Director General. The task force, you are exempt because you're giving a gift. But if you are willing to also do it, you can do so. I see the rector, physicians and surgeons also here. So any takers, let's do this quickly. The president has to leave us. Any takers? Oh, I should see it. Okay, I see a young lady. How much, please? Let me write. Who's taking notes for me? Thank you so much, Doc. I'm writing. Seydou Agungu, Alaji Seydou Agungu is giving us 500,000 Ghana cedis. Doc, are you taking notes? Otherwise, I'll take it away. Please, any other takers? Okay, Dr. Kaba. Our boss, can they go beyond you? Your boss says you can go beyond. Below the ministers, below their boss, above the ministers. MPs are here. Our development partners are here. Ask them, they are doing it already. So I see the Medical Association. Are we going? Going? You'll come later. Yes?
Good everyone. Yes, in the cities of course.
Thank you so much. Scanty salary for 2,000. Yes, sir. Okay. Yes, please. Hopefully, NHI will pay you, so you pay us. Okay. Yes, sir. Allied professional. The nurses are on show.
On behalf of our nurses and midwives, we are pledging 150,000.
Please. So I must say that this may not be a church that God will see, but this one we are following you and take it by force. Yes. 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 Health committee. Yes, sir.
Thank you very much. My name is Dr. Soho. I represent a branch of the medical laboratory group, which is affiliated to the NDC party. Donate 20,000.
Thank you. Any more takers? Let's wrap it up. Yes, sir.